Just FYI, Mr. Val is running late, so he'll be stepping in the meeting about 1:30. So of course we'll call it for Miguel, are we ready?
Thank you. Being that we have quorum, I'd like to call this meeting to order. Good afternoon. Today is Wednesday, September 17th, 2025, and this is a regular meeting of the Board of Trustees in El Paso County Risk Pool Board. This meeting will also be accessible via Microsoft Teams and via YouTube for the public. The time is 1:07 p.m. We currently have Chair Salcido, Vice Chair Van Hoop, Trustee Ancesio, and Trustee Garcia physically present. Chair Salcido, we do not have anyone signed up to address the board.
Moving on to the consent agenda. The consent agenda consists of item 3A through 3G. Does any member of the board wish to remove an item from the consent agenda to discuss in more detail?
Let's see here, let's pull item 3C up and 3E, the other report.
Does any other member of the board wish to remove an item? So then we'll move to approve consent agenda items 3A, 3B, 3D, and 3F and 3G. Do we have a motion?
Motion to approve.
I'll second.
Chair Salcido?
Aye.
Vice Chair Van Hoef?
Aye.
Trustee Asensio?
Aye.
And Trustee Garcia?
Aye.
Motion carries. Moving to, we're going to discuss then the items. So then we'll move to consent agenda item 3D for discussion. 3C, I'm sorry, for discussion. Item 3C, approve the monthly invoice from Hub International Benefits Consultants for July and August 2025.
Vice Chair Van Hoop, your question?
Yes. On the breakdown of the description of the charges, which is the second page. If you go to the bottom, can you help me understand why some hourly rate is $195 versus $155? I see for a half an hour on the phone, you charge $195, of course, broken down half. And then for the actual analysis, to create the analysis, it's only $155. So, could someone explain to you what the difference?
Yes, so if you see next to the description of the item, there are some initials. And so those initials are for the staff of Hub who conducted that item. So during the RFP process and evaluation and the negotiations, in the RFP, we asked vendors to submit their rates. This is per hour or their services. So during this process, Hub submitted their rates based on staff, the level of staff and what their rate would be per hour. So once we entered into the contracting and negotiations, we brought the contract before the risk board, and we, in the agreement, it states the rates, and based on who this level of staff is, that's their rate that they charge. And so on there, you'll see the initial, the description of the item, and you'll see the rate per hour. However, they also list the hours spent. So even though the rate is per hour for that individual is 185, if it's half an hour, it would be, the charge would be half. That's the explanation as to the difference in rates.
When does this agreement term?
So we're up for renewal this year, which is, that will be effective 1/1/26. So we'll be bringing that agreement during the November meeting for the board's review and recommendation to the court for approval.
Okay, I'm glad you said that. So given that, I recall that I sat on the committee with you all to review the RFP for the employees.
For
which
this,
was
for the
Edna
TPA.
Julia, correct. So with the RFP for Hub, who on this board will be allowed to participate?
We can bring an item before the board to, for the board to select if there's, the board is interested in having a board member be part of the RFP as an observer. We can do that. So we'll be bringing that to you. We'll go out for an RFP in 2027. So we'll bring that to the board's attention sometime in 2027 before we start the RFP.
So the renewal is not this year?
So the contract is for 3 years with an option to renew for 2 additional 1-year periods. So the first option to renew is this upcoming year. So we'll be bringing it back before the effective date of the renewal. And then in 2026, we'll bring you the second and last option to renew, and for effective 2027. So in 2027, we'll go out for an RFP before, and we'll make a decision before the end of the year.
$40. Is it worth $40? Okay, thank you.
So we'll make it note, our takeaway for staff is to bring an item during 2027 for the board to consider if they want someone from the board to sit as an observer in the RFP process for the consultant.
They've already agreed that it would be me. So do we need to go through that? whole
We need
process
to
every
take
year?
action, yes. Yes. And correct me if I'm wrong, Kevin, the board would need to take actual formal action to add somebody to, yeah.
There's no more questions on this item. I'll move to accept consent agenda item 3C.
Second. Chair Salcedo?
Aye.
Vice Chair Van Hook?
No.
Trustee Asensio? And Trustee Garcia? Aye. Motion carries. Moving to consent agenda item 3E, accept the Aetna report for June and July 2025.
Okay. In the month of May 2025,
That would be, I believe this is current year.
18,000 to, yeah, that one, that column, May of 2025.
It would be 2026. So as you recall, Aetna is still processing claims for last year. So they're reporting what they're paying, even though they're paying this year, they're for claims that were processed last year. So Aetna they still have all this year to pay out any claims for 2025 when they were under us as the TPA.
Correct, yes, that wasn't my issue. If we looked at the billed amount, it's 18,225. And what we allowed them to pay on that claim or claims were 34,315. So that means the percentage of allowed bill was here was 188%. Clearly not correct.
Hi, I'm Liz Bebo with Hub International. I don't know that we have anyone from Aetna on the line. Oh, she just arrived. Okay, I'll let her speak to that.
Gabby, could you hear us?
Did she hear the question?
No, I was gonna. Gabby, can you hear us?
You muted, Gabby?
Miss
Berenice?
Yes. Can you hear us?
I can hear you now. I don't know if I sound choppy. I apologize, but yes, I can hear you guys.
Okay, we can hear you clear. So the Aetna report was pulled for discussion. So Vice Chair Van Hook had a question with regards to the May billed amount and the allowed. So it looks like the billed amount was 18,000 and the allowed was 34,000. So that it seems off. So if we can explain what happened there.
I would have to pull the May report to see what it was. Actually, there I have 2 inquiries, not on that line, but I can add that line to my report. I actually had 2 inquiries on a separate table of this particular report that I was questioning, which I kind of noted on the side in red. But I don't have a response off the top of my head on that May report, but it definitely is something that I can submit to the AHIA database.
So if the board is not comfortable accepting the report, we can definitely postpone it and we'll provide it again during the November meeting and we'll have the responses or, maybe an updated report.
Absolutely. Yes, ma'am.
The answers to the board's questions. Was there another question?
My second question was, Gabby, the 2 in red. I just thought that's what you're working on, so
Yes, ma'am.
we'll
Those 2.
wait on that one as well. And then there's one more. Is May still? Yeah, I guess May just carried over into then and allowed, you have another one that says 128% allowed.
Yes,
given
correct. The month
contract-
before, those are the 2 we're asking on.
Yeah, given the contracted rate, it would not be anywhere near that. So if you can please provide a corrected version, not only do we want to know how it happened, then we want a corrected version, because what I don't want to see is every month just come up, because it drives me crazy. So if we can have a corrected budget, and we can also have notes as to how that happened, and why that happened, please.
Absolutely.
Thanks, Gabby.
You're welcome, team.
Hi, again, Liz Bebo with Hub International. I am looking at the detailed report for May from Aetna. And the reason why the billed amount and the allowed amount are skewed is because of reprocessed claims. And you have a very low volume of claims coming through. So a large reprocessed claim, meaning a large negative, is going to throw off those proportions. But I will provide this to the staff so that you can see each claim. For example, you have a large billed claim for 51,000, the allowed is 12,000. But then you have a large negative $30,000 billed and a large negative 27,000. So the proportion, when you're looking at the 2 columns compared, is going to be skewed. But I'll provide that detail for you.
So can you confirm that the 188% is incorrect?
No, the 188% is correct because it's a proportion. So you're looking at the proportion of the total billed versus the total allowed. The reason why it doesn't look like the prior months is because of the negative reprocessed claims being greater in proportion to the actual process claims.
So there are some claims that were reprocessed that are actually sending money back.
And
And
that
so
might
that
be the
negative-
reason why Mayline looks like that, yes.
It is. I have this detail foots to that report, so I'll send it over.
Okay, so when you go ahead and submit the notes, can you also put what claim number that was, not the person's name? I don't want to violate any HIPAA violation, but I want to make sure that I understand what was reprocessed, what was returned, what was, because 188 is more than double the amount of the contracted rate that we pay.
And it's because of those negative, and because if they were still our carrier, it wouldn't look that way because there's other claims that they would be paying that are a higher positive number. But because there is no more claims, that negative takes over as a higher number. And so that's why the percentage is off. But what we can do is we'll take off any identifiable information and we'll put the full report so you can see the negative numbers.
Please, yeah, I
And
don't
also the
understand.
total.
Yeah, so if you go line by line at each claim, on the positive claims, you'll see what you would expect relative to the proportion of allowed. It's because you have those large process claims that in that particular line, because for the month of May, you only had 47 claims processed. So it's just the averaging of numbers, but it's all right here in line items, and you'll be able to see the information you're requesting.
So didn't we have less claims in June?
I can pull up the June report, but again.
Wouldn't that have been the same issue?
So the months that are listed there is what Aetna's paid. So again, it doesn't coincide when the claim happened. This is when the claim was paid.
Yeah, discharge.
Right, so that June is whatever Aetna paid at that time. But for the month of June, that's the total amount that they paid.
Okay, so when we get the breakdown, I appreciate that. That'll help me understand. And then I would ask also that when we have issues like this, it's of course, it's glaring to us that we pay 188% of claims. That you pull it automatically from the consent agenda and move it to regular, because we're gonna have questions. Yeah, I do. I mean, I looked through everything, but still, it'd just be easier for us.
Or we can do like a footnote to explain why that percentage is, different from the others and explaining the reasons why. And we can attach a detailed report, absolutely, so you all can see the reasons why that.
Is there any way we could move it to regular? Just so that
We
nobody misses it?
Yeah.
Okay.
So for the November, instead of putting it in the consent agenda item, we'll put it into the regular.
So we're gonna have the backup.
We'll go over the back.
But thank you very much.
Can I confirm something really quickly?
Yes, go ahead.
With the backup and explanation Ms. Lisbibo gave on the May line, is that sufficient enough then for the board, and I can just focus on the other two items I was inquiring?
I still want it broken down by claim.
Yes, and so what Gabby's asking is if that will suffice so she can then inquire in the other two outstanding questions.
Awesome.
Yes.
Yes, ma'am.
Yes, Gabby.
Perfect, thanks y'all.
And we have a motion to postpone the consent agenda item 3E to the November meeting under the regular items.
I make a motion.
Second, Chair Salcido.
Aye.
Vice Chair Van Hook.
Aye.
Trustee Asensio.
Aye.
Trustee Garcia.
Aye.
Motion carries. We'll proceed to regular agenda item 4A. Discuss and take appropriate action on the 8th amendment to the Aetna MSA contract number 2025-0686.
Good afternoon, Mr. Chairman and members of the board. In 2024, the El Paso County awarded a request for proposal in RFP 24-016 to Aetna Life Insurance Company to serve as the county's third-party administrator, TPA, for the county's dental plan. Based on the RFP, the county, with the assistance of our health consultants, Hub, and Aetna Life Insurance Company, developed the 8th Amendment to the Master Service Agreement. The amendment sets forth the terms and conditions under which Aetna agrees to render services and under which the county agrees to receive and compensate Aetna Life Insurance Company for such services. The 8th Amendment amends certain services within the Master Service Agreement by the deletion of all previous services, as you may recall. As you may recall, Aetna was also our medical TPA. Therefore, the amendment removes all services related to the previous health plan with the exception of dental. The term of the agreement is for a 4-year period with a renewal option of 2 additional 1-year periods. And staff is requesting the risk board to recommend for the Commissioners Court to approve the amended agreement. Do we have any questions?
I do. Okay, so help me understand the the term of this agreement was going to be, or is, I guess, January 1, 2025. We are in September, so you're asking us to approve an agreement that clearly was not in place. It's still not in place until September of this year when we approve it. I'm very concerned about going back 9 months.
So when the court approves the RFP to a vendor, that automatically sets the approval to start services. The agreement is just formality to say, yes, the county is in agreement with the terms, the specific conditions, services, fees tied to it. So the contract itself is formality. Yes, it is late in the year. Aetna did have, I don't want to throw them under the bus, but there was a delay in providing that information to us, and we went back and forth and did the contract negotiations until we got to an agreement and were able to place it on the risk board's agenda. But this is basically just formulating and in a formal matter that we are in agreement with what we had said in the RFP of the services that they were going to render and the services that we were going to pay for what they're providing.
So that said, you're here to ask for the board to approve.
To recommend for the Commissioner's Court's approval.
That said, we're not allowed to see any documents. We're just here to approve it. We move forward, taking it to the Commissioner's Court.
So you're basically saying yes, based on the awarded vendor that the county approved for, which was Aetna to provide services for dental. You're saying, yes, we knew about it. Yes, we agreed that this is what, Aetna was going to provide. So you're in agreement with what has been approved.
So, let me check for a second. So this contract was approved as of the 1st. And as she said, 9 months later, risk pool board is being asked for its approval. And I'm kind of wondering, is it really required? Because it says take appropriate action. At this point, approval's already been made. So it'd be more along the line of not necessarily approval, but acknowledgement of the actions that have been taken, which is totally different. It's not an approval, it's that we are now aware of, and thank you very much. Basically, that's.
Well, yes, but so the motion that staff is asking for is for a recommendation for the Commissioner's Court approval. So you're recommending that the county continue with this and approve it.
So in other words, it's an approval.
It's a recommended.
We're not
So
allowed.
recommendation. So it was approval. It still had to be loose ends tied up, and it's finally finalized. And okay, seems like it's good to go.
So you're basically giving us your blessing that we can move forward to place it on to Commissioner's Court for their final.
Without knowing the actual details.
We provided the agreement that had the details of the terms and
These
conditions.
are the actual details.
Correct.
Okay. The actual details on this document is 1 page.
So it has the agreement and then there's the exhibits that list the detailed services and fees.
No exhibits. This was not presented. All that is presented is
1 page.
1 page recitals, agreements with 4 items on it, and then a signature page. That's it.
We're checking the posting.
It does say the updated dental fee schedule attached to the amendment as exhibit B, but that was not present. Also exhibit A.
Can you pull in on the screen? while we do our research on the backup, Jerry's gonna pull up the exhibits.
Just for clarification, the backup item that was provided indicate references a contract dated 2013. Again, this is a renewal. Aetna had always been the dental provider. This is just extending it effective 2024 into 2028.
2025 to 20.
25, yes.
Yes.
All right, thank you.
So on the exhibit, it's listing the rates that was provided during the RFP award. So the rates that they listed on the award is what is in the exhibit. The exhibit is detailing exactly what those services are.
The people that we didn't receive.
So, but in the RFP award, it has the rates that we're agreeing to.
How long ago was that?
The award was back in 2024.
And it's a 3-year contract?
It's a 4-year with 2-year option to renew.
And can I ask you to clarify, are you suggesting that because the rates are made explicit in the RFP, that the exhibits are not necessary for us to review?
No, it's not, no, I'm just letting you know that it's not gonna be different from what was awarded.
It's the same amount. The
Yes.
rates didn't change.
Correct.
So what was the hiccup that it's
So the-
taken so long to respond? Okay, never mind. Okay, enough said.
Okay, so if you notice in the exhibit, it will list that it's removing all services that was done before. So the medical, the pharmacy, the stop loss, all that is basically they're saying, we're agreeing that we're not your TPA no longer for that. So it's memorializing what we agreed, that they're only gonna be providing dental services. So if you can keep going down, please. So there, it's listing the sections, all, the medical, pharmacy, all that's being removed effective as of January 1st. So it's listing everything, keep going. The flexible spending, the health savings account, all those are being removed. And so it's listing each service that's being removed. The COBRA, they also used to administer the COBRA.
And are we in agreement that we did not receive the?
Correct, it wasn't by error, it wasn't added as part of the backup. But this is the exhibit that failed to add it to the backup, yes. Yes. So that first one is listing, county, we're removing all these services that we provide to you, we're just gonna do dental. Then here it's the dental fee that they were awarded for. So it's saying what it was and what the new rate will be.
Before.
We will absolutely send it to you, yes.
So are they doing a 4% increase across the board?
Go back up. So that's in the years of renewals
The second year? Oh, third
in
year,
the third year, yes.
4%.
Uh-huh. And the others is just details of what those services are. Sorry.
Sorry.
So based on this agreement, for this amendment, would only be in year three, starting year three, 4% would be the rate escalator.
Correct.
Yes.
Correct, yes,
No other increases.
correct.
Now, next year, could they change the rate?
No, because this is
It's
what
locked
we're
in.
saying.
Yes.
So this is exhibit A.
Exhibit A
And B.
Mhm. So B, if you go back up, sorry, where it started talking about the dental fee schedule, that's titled exhibit. But yes, we will email you the exhibit, and it's gonna be all in one attachment, the A and B. Any other questions? No?
I'll make a motion to accept regular item 4A.
Chair Salcedo?
Aye.
Vice Chairman Wu?
No.
Trustee Asensio?
Aye.
And Trustee Garcia.
Aye.
Motion carries. Moving on to regular agenda item 4B. Discuss and take appropriate action on the Second Amendment to the flu vaccine agreement between El Paso County and University Medical Center, El Paso, contract number 2025-0715.
Good afternoon, Mr. Chairman and members of the board. In order to reduce the spread of influenza, El Paso County and the University Medical Center, through an interlocal agreement, provide influenza vaccinations to all county employees, whether or not they are enrolled in the county's health plan. County employee dependents who are enrolled in the county health, for those that are enrolled in the county health plan, county employee dependents who are enrolled in the county health plan, and county retirees and their dependents enrolled in the county health plan, but not enrolled in Medicaid or Medicare. The influenza vaccinations are free to all county employees as well as dependents and retirees enrolled in the health plan. The county, through the risk pool fund, covers the cost of influenza vaccination. The amendment will be effective October 1st, 2025, regardless of the date of execution, and will continue until September 30th, 2027. Staff is requesting for the risk pool board to recommend to the Commissioners Court to approve the amended agreement.
I move to,
I'm sorry, yeah, I have a question. Okay, so, just to confirm, it's free to all employees and their dependents?
Yes.
So even though they have insurance or not, they're still it's gonna be free. Then we are gonna pay $45 per.
So if I may clarify, the dependents have to be on the medical plan in order to receive the free flu shot. So the employees are the exception. In all employees, whether they're on the plan or not, they get it free. But their dependents, they do have to be on the plan.
And if not, they have to pay how much?
It would be what the charge that UMC would deem appropriate for non-insurance.
Okay, so we don't know.
show me to Google and see what the average going rate is for flu vaccines this season.
You get down to being more or less an idea. We don't know until UMC says. So if UMC, it's okay, it's gonna be $12. I don't know. For those dependents that are not on the insurance, we're paying $45 per person, whether, okay, so is the $12 or $15 removed, deducted from the 45?
No, so that would be a separate charge. They wouldn't charge the county. So they're gonna invoice the county for everyone who's eligible to receive a flu vaccine. Anything outside that they decide to administer, it would be between that individual and UMC.
So we're gonna see that they gave 900 vaccines, but only charged us for $725. Because some of the 175 weren't eligible for that and paid whatever, security chooses to. Okay, then I don't need to know. As long as we're not double dipping and we don't have to pay for the 900. Okay,
If I may add, we do also partner with the city, and the city provides free flu shots. So if there are dependents that are not on the medical plan, they can get their vaccine through that as well.
That's great.
for free.
For free, completely free. And
Proaction. That's really great.
Yeah. So no one will do that because it's so funny. And the one gets charged that everyone's gonna get it free.
Right.
Thank you. That's all I wanted to hear. Okay.
Do we have a motion to accept regular agenda item 4B?
I move to accept the agenda item 4B. And I applaud your efforts in preventive care.
Thank you. Is there a second?
Second.
Chair Salcido?
Aye.
Vice Chair Van Hook?
Aye.
Trustee Asensio?
Aye.
And Trustee Garcia?
Aye.
Motion carries. Moving on to regular agenda item 4C, discuss and take appropriate action to accept the bi-monthly reports from Hub International Benefits Consulting.
Good afternoon, Liz Bebo, Account Executive for Hub International, work with the county on the health plan, employee benefits, and I also have Patrick Avila with me, who is going to be running the presentation. So I will apologize in advance. Some pages got turned around, but I think we'll be fine. Turning to the summary, we are looking at claims paid through July of 2025 in the current health plan year. The net medical and pharmacy paid claims, which include the Aetna runout, are running at $787.39 per employee per month, compared to $845 per employee per month for the full year of 2024. We do see that the one of the main drivers of this variance is that claims greater than 150,000 are developing more favorable in 2025 than they did in 2024. There were a total of 27 claimants over 150,000 at an average of $419,000 in 2024. Through July of 2025, there are 13 claimants at an average cost of $317,000. So fewer claimants from a run rate perspective at a lower average cost. 8 claimants that we are tracking over 150,000 on the 2025 high cost claimant list are recurring from 2024. So these are, some of them are not new and will continue on the plan as long as they're in this category, as long as they're being treated as such. When we look at administrative expenses and credits, along with pharmacy rebates, through July 2025, the plan is running at $633.50 per employee per month, compared to the full year of 2024 running at $953. We have included in the July numbers, the Blue Cross Blue Shield administrative credits at 1.2 million. Those were recorded in January in our reports. And then also you do have 2 runout payments of pharmacy rebates from Aetna that are included in 2025 for a total also of 1.2 million. So that combined 2.4 million, which you did not have in 2024, is really, kind of driving the difference in that line item. The dental plan is running at $36 per employee per month, compared to 24 of $38 per employee per month. We do not expect to see any significant difference between 25 and 24 relative to dental. Yes.
Liz, there are 2 rebate payments. Were they already recorded?
Yes.
Or,
Yes.
because the other one says recorded in January. When were these recorded?
So you received 2 payments, one in March and one in June. So under the Aetna contract, those rebates are paid in 90 days in arrears. So excuse me, 180 days in arrears. So you've received your last payment from them in June, which was for the period through December. And just as an informational item, on the pharmacy contract that you have now with Blue Cross Blue Shield, you received that per employee per month pharmacy credit, but there will be a true up they'll look at actual earned rebates versus the credit, and that would happen in, the reconciliation would be due in June of 2027.
Thank you.
So yes, of course. So right now, we do feel like the plans are running well. And if you'll jump to the 2025, and apologize, you have to look at this on the screen. This is where our pages got flipped over.
Jerry, if you don't mind, I'm gonna go ahead and share.
Of course.
I'm just being right quick, and then I can continue driving.
Yes. Oh, were you driving? I'm sorry. I thought I was driving. All right, here we go. And if we just want to enlarge that, you'll see right now we have average enrollment of 4,300 members, 2,600 subscribers. On the far right, that is very similar to, so not real fluctuation in the rolling 12 months. The reason why we look at rolling 12 months is because when we're doing our projections for 2026, we want to take the most recent 12 months of claims as our indicator. On the Aetna run-out claims, to date, you have 1.9 million. In June, you had a large reversal of Aetna, which is why in June you have that negative number. Also to our earlier discussion, which is what's throwing off that allowable calculation, because you had a large $200,000 claim come through as a reprocessed claim. And then I'll just draw your attention to the bottom line, or the bottom section, where you'll see the Blue Cross Blue Shield pharmacy credit. And you can see that's averaging about $440,000 a month. Again, that helps your cash flow because you're not waiting for those payments that are happening on the quarter. Okay, so turn back to the presentation, Jerry. We can go right to page 5, please. Sorry, I threw a curveball up there. On the, this page here, we're looking at the inflation trend. So we can see that on the blue line, which is your medical only, and on the green line, which is your pharmacy, those are both trending down in January. Again, those are related really to the complexity of those large claimants over 150,000 and some of those higher priced cancer patients coming off the list at this point. Some of them will come back on as their treatments become ongoing. From a inflation rate perspective, when we look at the bottom left in the rolling 12 months, we do see that negative trend, as I just spoke to. We know that in calendar year 2024, there were several large claimants that really drove up that trend, that inflation trend. And we do expect to see that mitigate back towards We would expect to see, probably about 7% medical trend and maybe 12 to 14% pharmacy trend by the time that the year is completed. And then we do have for your information here on the right-hand box, that is your auditor's report. In the month of August, revenues exceeded expenses by 735,000. And then your fiscal year-to-date revenues have exceeded expenses. And then your fund balance, as reported by the auditors, through August 31st is $26 million. Sorry. On page 6, I would draw your attention to the right-hand corner. This is where we're looking at the high-cost claimant experience. We can see for 2025 year-to-date, those 13 claimants I mentioned earlier, over the 150,000 versus the 26 in the prior year. We do expect to see the reimbursements to the pooling over, the individual stop loss level of 300,000. Anything over that on an individual claimant basis would be refunded to the county. We are tracking those reimbursements. I would also say that this is the corner that we look at because this will be the most influential in the stop loss renewal, which we should have towards the middle of this month of September. Yes, towards the end of September.
We'll bring it back to the board for review during the November meeting.
With the different options for the cap amounts.
Yes.
Stop loss.
Yes, we will start with the 300,000 and then we'll look at 325 and 350. And we'll look at, there's an equation that we look at relative to how many large claimants do we expect versus how much would the premium savings be to take on the additional risk under the individual stop loss level. The health plan projection on page 7, so the health plan is a line item within your health plan fund. So what we look at and help you track are the expenses that are directly related to the health plan, such as administrative fees, claims, pharmacy, rebates and such. And looking at that, we are looking at the health plan projection. So again, the health plan is on a calendar year for 2025. We have made the projection, so we're expecting about a 10 million positive change, assuming that claims run the way we expect. On 2026, we've added a line item based on the direction of staff to adjust the funding down by the 3 million for 2026. It's actually 4 million, but only 3 million. It's a 4 million for the fiscal year, but on the calendar year, only 9 million will hit in the 2026. And what we're essentially saying is that the county will contribute less towards the expense of the health plan than they have in the past by that $4 million.
So I have a question. So, okay, so you're saying that we're adjusting the funding by 3 million for 9 months?
Yes.
And that's because
So that's gonna be under my report.
Oh, sorry, I jumped ahead, I apologize.
You're the intro?
Yeah, and she'll explain it, we're just reflecting it in the numbers,
okay.
yes, but, so at any rate, based on, we do put a 5% claims margin into our projections, just because of the nature of claims, and we really, does the current really reflect the future? But we do expect that, 2026 will, you'll continue to have that positive balance, coming out of it.
So the health plan projection, we're saying that this is a draft. When we approve your document, we're not approving this projection. Right?
No, this is more informational of how we expect the plan to run in the plan years. Based on our, we trend forward claims on a rolling 12-month basis.
And what the board is doing, they're just accepting the report. They're not saying whether they agree with the report or
Okay.
disagree. You're just accepting the information that's being provided.
Thank you.
On the pharmacy reports, these on page 8, this report is provided through the Blue Cross Blue Shield reporting. This is on a slightly different basis. This is looking at January through July of 2025. And it's really just giving you some statistics about how your pharmacy benefit is being used. There really isn't anything here that I would point out as an area of concern. I will just in the middle, and I may have talked about this before, the generic dispensing rate prior to brand drugs such as the diabetic GLP-1s really coming more to the forefront, we would see generic utilization rates of 94%, 95%, but as brand drugs have become more dominant in the mix of utilization, that's why we're seeing that decrease. It's not people are abandoning generic drugs for brand medications. It's just that there are therapeutic brand drugs that are not available as generics. On page 9, we just, here, we're just looking again at non-specialty drugs. So again, these are specialty drugs or drugs that tend to, they're either very high cost or they need to be administered by a healthcare provider. So these would be your typical drugs that we would get just in a pharmacy environment. We can see that the on the bottom part here, the treatment of diabetes drugs are the most prevalent on your plan. And then we do see that number 9, the Paxlovid, that's for the treatment of COVID. That is starting to kind of move up on the top 10. 1 for utilization, but 2 because of cost. Are there any additional questions that I can answer relative to the plan performance?
Okay, thank you very much for
Thank you.
that explanation. I'll go ahead and move to accept item 4C.
Is there a second?
Second.
Chair Salcedo?
Aye.
Vice Chair Van Hoen?
Aye.
Trustee Asensio?
Aye.
And Trustee Garcia?
Aye.
Motion carries. Moving on to regular agenda item 4D, discuss and take appropriate action to accept the Human Resources bi-monthly reports to the Risk Pool Board.
We are almost there. I am sharing the HR report today with Berenice, so I'll do the first couple of items and then she'll close us off. So just wanted to let you guys know, reminder, open enrollment is cleaning up in October, the full month of October. We are very excited, especially because A lot of our teams is their first time, so we're excited to exposing them to the open enrollment period. So of course, as always, we do present you guys with a report on the open enrollment results, so that will be coming in January. Also we do have our 4th Fitness and Wellness Center Anniversary Health Fair. It's set for October 1st, so also kicking off open enrollment, so perfect timing. As you guys know, every year we do like to do a theme. So any guesses on what our theme is for this open enrollment based off the flyer?
Fourth board.
Yes, yes. We couldn't pick one because we kept fighting over one or the other. So we're just gonna do sports. So definitely all sports. So the board, of course, is welcome to attend, and we can forward this flyer to you if you like. Also, something interesting for this health fair is that Chico from the Chihuahuas, he actually will be attending. He will be there from 8:30 to 9:30, right? So that hour is going to be interesting. We also have Blue Bear from Blue Cross at the health fair, so we want them to do a dance off. I don't know how to. So that'll be fun. Of course, for those that can attend, we'll share pictures afterwards so you can see that. And we will be offering flu shots at these health fairs as well, administered by UMC, of course. So plenty of opportunities for employees to take advantage of that. We also are going to hold our 2nd health fair, which is usually at the sheriff's office on October 22nd. So if you're in that neck of the woods, you can join us that day.
All the way on the east side?
Yes, yes, that was Sarah's office at the headquarters in the cafeteria. So like I said, I'll go ahead and share the flyer with you all in the email so you can have that information on hand. Also, we have the continuation of our on-site wellness screenings during this month and next month. So we actually have one going on today at Sheriff's, right, Ruby? So Sagan's over there right now, manning the fort over there. I believe we had 12 sessions, right, overall that we offered to employees. So plenty of opportunities for them to take advantage and do their wellness screening with Catapult so they can get that premium discount. So of course, once the screenings are over, we'll provide in a future HR report the results of how those went.
But the premium discount is
6%. So that doesn't include, of course, they have to do their screening, and then they do have to follow up with their nurse practitioner from Catapult in order to be eligible for that 6%.
Catapult.
Catapult replaced Quest Diagnostics. So now it's Catapult, that's their lab that Blue Cross follows. And they're not local, but which is why we offer so many screenings here, so the employees can take advantage of those.
Okay, that's great.
Okay. So as promised, I did have an update on the reduction to the county's contribution. So as you recall, during the March risk board meeting, staff did present the medical and dental plan design recommendations for plan year 2026. So as you recall, one of the items was the 6% premium discount if employees completed their wellness screening with their nurse practitioner. The other was a reduction in the family tier by 4%. So we're reducing the family tier premium, and that's whether they're on the consumer driven or the core plan, we're reducing that by 4%. Then the other recommendation that we proposed was an increase to the health savings account if employees are enrolled in a health savings account, where the county contributes. Currently, it's at $1,200, and so we recommended to increase that $1,500. The board did recommend that versus it be across the board, it only apply to those under the dependent tier, whether it be children, spouse, or family. So the board did approve the Bristol board's recommendation, so they moved forward with continuing to contribute $1,200 for employee unit coverage and $1,500 for those enrolled in the dependent tiers. So those were the recommendations we presented to the court. And so the budget hearings continued throughout the year. One of the items that staff did bring back to the court due to the county's financial state, we were asked if the county can reduce their premium contribution. They did ask if they can reduce it by a total of $4 million. So currently the county contributes, correct me if I'm wrong, around $30 million. They contribute total for a whole year, $30 million. So they said instead of 30, can we reduce it by $4 million? And so we worked with our consultants and we did work the numbers based on the state of the health fund, how it was doing, performing, and can we afford to receive $4 million less for one whole year? So we worked those numbers. We identified that the plant is doing very well. As you saw, we're about 26 million, which is really good. It's been the highest, I think. It's been, I don't know, since I've been here, I know it's been the highest. So that's, of course, attributed to your approvals and the changes and recommendations that you all have given as the board. So we took that back to the court. We let the court know, based on how the fund is doing, we can support receiving $4 million less in this next year. And so we'll be working towards receiving $4 million less. But the plan will still be at a healthy state, where we'll still be able to pay for our claims. And I think in your projections, it's still at a very high number.
That's great news. Yes, and I'm glad that we can give mom and dad $4 million back.
We'll receive less. Less allowance.
Yes, so we're 26 versus 30. My only comment would be is that when it comes to something like that, I'd like to hear before, not after the fact that you've already gone and said, oh yes, we're gonna give you the money. If we would have known, I mean, it's just, it's $4 million
Right.
less that we're going to have in our budget. And since we're responsible, we at the table are responsible for the municipal board and for the county board funds. I would have just appreciated it. Yeah, you know what, mom, dad came to anyone out there asking, what are you saying? Well, yeah, we're gonna give it to them. But you just, okay.
So
So
this
next
is,
time when it's something
this
like
is,
that.
during the budget hearings, there's a lot of discussion going on between, the court and the department heads, elected officials. So they asked us the question, is that something that, based on how the plan is performing, is that something that the risk fund can afford to not receive? So the county has the authority to decide whether or not they want to fund the plan. So it's at their discretion whether they want to do it or not. So they have that authority to be able to decide, you know what, this
Okay.
year, we're only gonna contribute so much. And we just receive the directive and we move forward, and we make changes based on how much funding we're gonna be receiving. So we did, this hasn't been, it hasn't taken place yet. So we're letting the board know that is the plan to do for plan year 26.
Okay.
We haven't taken action. We haven't not received that money.
When did they ask if the school board could afford it?
When did they ask? During the budget hearing, which takes place, they're meeting every month until the end of the
So it was
fiscal.
just recent.
Mhm.
So it was within our 2-month lapse.
Yes,
Okay,
Yeah.
that's why it kind of,
it was
It's
in
new to
between.
us.
Yes,
yes,
Yeah.
okay.
yes, but we believe it's our duty to let you know what was discussed during that time.
So no approval needed.
Right, because it's before the funding gets sent to the risk pool fund. So they're not taking money from the account. They're just sending us less money.
That's okay. Mom and pop.
Yeah.
So 4, I think we're gonna make it 8. Yeah.
And so it'll reset for the next plan year. It'll reset to at least the 30 million that they used to contribute to the plan.
Thank you.
Thank you. I'll make a motion to accept item 4G.
Second?
Give me 1 second. Chair Salcido?
Aye.
Vice Chair Van Hook?
Aye.
Trustee Asensio?
Aye.
And Trustee Garcia?
Aye.
Motion carries. Moving on to the last item, to adjourn the meeting. Do we have a motion to adjourn?
Motion to adjourn.
I'll second.
Chair Salcido?
Aye.
Vice Chair Van Hook?
Aye.
Trustee Asensio?
Aye.
And Trustee Garcia? Aye. It is now 2:11 p.m. the regular meeting of the Board of Trustees for the El Paso County's Municipal Board is now adjourned.
Thank you.
Thank you.
Thank you.